Warm welcome to you from Geneva, Switzerland. I'm Reda Sadki from the Geneva Learning Foundation. I'm here today with Charlotte Mbuh, who has been preparing these daily bulletins, these live ideas or ideas live. We're still not sure exactly how to call them. How are you doing, Charlotte? And how is your connectivity?
Well, greetings to everyone. I'm doing good, Reda, and so far so good. I continue to keep my fingers crossed that my connectivity won't let me down during the session, but I'm optimistic.
All right, so this is all about the COVID-19 Peer Hub, and the exciting news is that if you have not yet received your letter to inform you of our decision about your application, you will in the coming, obviously in the coming days, because on Monday we will be holding the first event for accepted applicants. We're still receiving applications, so you have a little bit more than 2 days to apply. The application, we do ask you for a lot of information, but that is because we are building a picture of what is happening with the pandemic through this application, in addition to using it to determine what we'll be doing with that information. Now, what's very exciting is that to introduce our guest today, we are going to speak with her, but to tell her story, she has actually brought us a video, and so we're going to share the video, and then Charlotte will introduce her, and we'll be able to speak with her. Again, we are bringing you each day this week. This is the final day. We are bringing you stories from the field practitioners who are working in districts, districts, health facilities, capital city, all levels of the system, and sharing exactly how they are adapting to the pandemic. So let's go now to watch this video together.
I found that my son was seriously sick. I tried to talk to him, but he couldn't say a word. His temperature went so high that I could not imagine. I took him straight to the hospital. I thought I was going to lose my child. The doctors told me that my son was suffering from rotavirus. Rotavirus is a deadly infectious disease that can cause severe diarrhea. I'm a teen mother. He got vaccinated. Why is he sick? The doctor was kind enough to tell me that such cases sometimes might have failed. Vaccines, when they are not well taken care of and aren't kept in cold, can lose their potency. We were in hospital for 7 days. He got well. I was happy, but I still needed to know more. I thought of other mothers whose children could be in similar danger. I did my research. I wanted to educate my community why taking care of vaccines properly and in cold chain is so important. Today, I run my own organization. I work with Ministry of Health. I work with public service. I work with maintenance of cold chain equipment. I would not want any child to go through what my child went through. I will continue to support educating people about why vaccines are so important. They save people's lives.
So with us today is the person whose story is told in this video. So I'm very pleased to welcome Angela Kisoso and Charlotte. Over to you to introduce our guest, and then to get into the specifics of how Angela, with this story. Yes, there is COVID-19, but many professionals in immunization have been working with commitment, with diligence for years, and have been personally affected by both the pandemic and what came before. Over to you, Charlotte.
Thank you very much, Reda. Good afternoon, evening, everyone, depending on where you're joining us from. And so today, as guests, we have Angela Kisoso, all the way from Kenya. And so, Angela, I'm just going to invite you to tell us who you are and what you do, where you do it, and how you came about doing what you're doing. I know the video has started, but can you tell us more? Over to you, Angela.
Thank you, Charlotte. Thank you very much. Thank you, my viewers. My name is Angela Kisoso. I'm from Nairobi, Kenya. I'm the CEO of Sanica Limited. I work with cold chain systems. I'm the representative of B Medical Systems based in Luxembourg. Our main objectives is to supply, install, and to make sure that cold chains equipment are able to function. And because of the sensitivity of vaccines, we're able to monitor the cold chain system through a remote control. This is a GCM software. So we're able to see and to know when the temperatures are not good enough for the vaccines. And we are able to contact the facility and to notify them that maybe there's a problem with equipment, or maybe they forgot to and they left the door open. And we're able to work with the Ministry of Health
and other organizations and immunization facilities and health workers on proper care of vaccine storage.
Thank you very much, Angela. Can you tell us a little bit about the COVID-19 situation in your country and how it impacted immunization services and cold chain in particular?
The COVID-19 situation in my country, Kenya, is not so good. It looks like it keeps increasing by day. We have statistics, and we've been following up. The statistics show that we have 15,600 positive reported cases. We have good news of 7,135 recoveries. And we're sorry to say that we have lost about 263 people due to this epidemic. We have health workers and personnel who have been affected with the COVID-19. Due to high situations, we have media coverage, which sometimes can be a bit scary, but we hope for the best when we follow the right procedures that are required. I would like to say that the government of Kenya has worked so hard to support and to bring up information to try and to have preventive measures and to have them knowing the right knowledge of what COVID-19 is.
Okay, so can you tell us how has that impacted immunization services? And just before you answer that, just to say we are beginning to have some questions directed to you on the chat. We are going to look at them in a short while. And also there are those who are watching on Facebook Live will surely be asking questions, and Reda will be able to read out those questions to you in a short while. So what is the impact of COVID-19 on immunization services?
The impact of COVID-19 in immunization process has been affected because we have people, the caregivers are scared to go to the facility to have their immunization done. So then we see people, the turnout has been very low. It has gone as low as 85%. Because of the fear, they believe that maybe when they go to the facility, they would contract the disease. At the same time, we have fear from the medical practitioners who don't have proper gear or protective. There's this situation where people are afraid to be infected by COVID-19. So this has affected the
Okay, so can you tell us how did that affect your work?
Yes,
that has to do with cold chain maintenance.
Thanks, Charlotte, because I was thinking,
Yeah,
thank you, Angela, for sharing with us, giving us a picture of what's happening for the country. But of course, in these live ideas, we're actually interested in your personal experience. What are you doing as a stakeholder, as a leader? And I think that's where the most interesting things might be, and how you have been adapting, and you, especially with respect to the work, as Charlotte has just said, with respect to coaching and mentoring.
Well, as a caregiver, I did not stop to do the maintenance of cold chain equipment. We had a situation in our country where the government had decided to lock down and stop movement from one county to another. And this affected the facilities, because then we were not able to travel to certain areas where the equipment had broken down. So I went to the Ministry of Health to seek authorization for us to have permission from the government to travel from the main city, Nairobi, to other cities and to different dispensaries in the country. We have been managing very well and making sure that whenever there's a breakdown of cold chain equipment, we have responded on time, and to make sure that the vaccines are also stored well, despite all the challenges, we feel that we are supporting the immunization system by being there and supporting the staff at the facilities when they have problems. They're able to contact us and we're able to contact them remotely.
Okay, that takes me to the first question in the chat from Shalini Kare in India. She's asking, hi, Angela, are there VVMs on the vaccine? I hope you know it's the vaccine vial monitors, you know, to monitor if the vaccines are still in a good state if they've been exposed to heat, maybe because of cold chain failure.
Sorry, please repeat.
Okay, so it's Shalini Kare that is asking, hi, Angela, are there VVMs on the vaccines? That is the monitoring system that monitors if vaccines have been exposed to temperatures higher than usual.
Yes, we are able to contact the facility when we notice that when the temperatures have gone high. Of course, vaccines are mostly stored under 2 to 8 degrees temperature. So we are able to notify the facility. We have the contacts of about 1,000 facilities within the country. And we're able to tell them that the vaccine stored in that equipment might have expired or was exposed conducive to the vaccine.
So just for me to, I'm trying to understand. So basically, what is it that while other people, basically everything had stopped because of the news about COVID, because perhaps of confinement measures, that you kept going. You made sure that you and your team kept the supply chain that you were involved in going despite the risks and despite the unknowns. Am I understanding correctly?
Yes, we kept going. We got the authorization, and we also kept in contact with WhatsApp platform with most logisticians who are based in the so we kept contacting them and telling them in case of any breakdown that we would still offer our services as required.
Right. And so tell us why were other people not able to keep going, or what did you do, and why did you consider it vital to keep that supply chain going?
To me, it's my responsibility. It's my duty to make sure that since the warranties are in place, and from my parent company from Luxembourg, we have the duty to make sure that we monitor and also maintain the equipments in good shape. So I felt that I did a step ahead to support and to make sure that we are on reach on time. So without this authorization letter, it would have been very hard for us to visit, but because I took a step, I went to the ministry, I showed how important it is, not only for the vaccines to be administered, but also for the vaccines to be stored in the right temperature. Then we need a proper functional equipment.
Great, thank you. Thank you, Angela. Back to you, Charlotte.
Okay, thank you, Reda. I just wanted to ask you this question, Angela. What were you doing differently? Within the context of COVID, you've talked about taking the authorization, but what were you doing differently compared to what you used to do normally before COVID-19? What was different this time around?
This time there was a bit of challenge because then it was not as normal as before. Before we could travel without any restrictions. But in this case then, because of the challenges faced by the COVID-19, when we had the lockdown, it was it was our effort to make sure that then we're able to give these services.
So how did you, Angela, did you have staff who were concerned for their own safety? And what can you, if so, can you tell us what you told them? How did you reassure, inform, and protect people in your organization?
Yeah, well, there's this facility we went to, and the health facility, the staff were scared because we came from a region where it was highly infected. But we also told them that it is important for them to wear their mask. We have emphasized on wearing of mask for caregivers and also for people working in the facility to protect themselves, not to get infected. We've also given them advice that COVID-19 can only be spread through let's say fluids from your mouth. So, but then if you're protected and you have the right gear and you sanitize and clean your hands regularly, and also practice social distance, whereby if the people come into the facility to get the immunization, then they have to sit in a manner whereby each person sits in a distance away from the other. In this way, then we would limit the spread in case of anyone who is infected.
And had you ever had to do anything like that before in your work with other outbreaks or other fears of outbreaks? Or was that the first time you had to adapt in these ways?
This is the first time we've faced this challenge, but we hope to cope and to help the health facility personnel, to encourage them that it's a calling of help and that we have to give help, because we all need to make sure that the immunization goes on.
So we have a comment from Okello Ogwal Hillary, which from Facebook, and then we have two questions. Cold chain maintenance, says Okello, was not easy with us after lockdown. Refilling gas was so challenging, not until the district health team intervened to help us bridge the gap. Were there any, for you, Angela, were there any problems that came up that you did not expect? I would never think that, it was a surprise to me when I read this comment that refilling gas, but obviously it would be under confinement, that would be a problem. Well, were there any other surprising problems that you faced that you were able to resolve?
Not as such, because it was something that we were doing before. Despite that lockdown was there, but when we got the authority, then it ran out smoothly like before.
All right. Mohammed Imran from Pakistan wants to know how the required number of vaccine doses supply is ensured to be supplied to the service delivering points during the pandemic.
Well, I don't deal with the supplies of the vaccine. This is done by the National API manager in case of Kenya. And our main objective is to make sure that the vaccine storage equipment is functional and running smoothly to keep the vaccines safe.
All right, we have a question from Shalini Kare, who's with us in the Zoom room, who asks what has been the percentage of breakdown for cold chain equipment during the COVID-19 epidemic in Kenya, and implicitly, is it different from what it's been in the past? Has cold chain equipment been breaking down more or less, or what's happening there?
It's normal. It's as before. I would not say there was an increase of breakage, but when they break down, then you don't know whether it's going to break down. When they break down, the most important thing is that you're able to move the vaccines from that equipment to another one, and also be responsive fast to solve the problem before the temperatures variation go up. So in my case, I would say there has been no much of complaint on the breakdown of medical equipment, but at least we're able to continue with the work as before.
Doreen Imanyara on Facebook wants to know, so I don't know if you're actually involved in this type of work, wants to know if you've been conducting outreaches, and if so, what is the response from the community?
I don't contact the outreaches directly, but we work with EPI managers in case they need transport boxes from us as a supplier. We have been in contact with the public on outreach and importance of speaking about vaccines and informing people that vaccines are important, and also being interactive in educating people about the importance of vaccines. In my case, awareness is important, as also administering the immunization.
And I would add a separate question. So in the work, moving vaccines around and getting them to where they need to go, have you faced, from the communities you work with or that you drive through or stop in, have you faced issues with fears or rumors being perceived, in ways that are incorrect in terms of the work that you're doing, what exactly you're carrying? Have you had to face and respond to concerns or issues or fears or rumors there?
Well, there's fear that in case COVID-19 vaccine comes up, there's fear that people are afraid that they'll be injected with the COVID-19 itself. But this is a rumor. We still don't have COVID-19 vaccine.
Right, and it's not only a rumor; it's false, right? Because and that's the important part.
So there's that fear. There's fear of people getting immunized. They think it's you're being given the disease, but this is just all rumors.
Yeah. So there's a question. So this sort of is a bit outside the scope of what the kinds of issues we want to address in the Peer Hub. Raul Saho does ask it on Facebook, so I'm going to share his question. He says, "Do you sometimes feel your hierarchy?" So he's probably working in the Ministry of Health, which is not your case, Angela, as you lead a non-governmental organization. Do you sometimes feel your hierarchy is prioritizing, overemphasizing work to fight COVID-19 to the detriment of immunization? What do you do to reconcile the need to solve the immunization problem that you see and meet the sort of priorities and work with the priority of the hierarchy for whom fighting COVID is priority number one?
Well, with the hierarchy, we work under the Ministry of Government. We work with the government, and we cannot work as a different identity. We work as a team. And I have gotten the support from the Ministry of Health in this case. And we also exchange our reports with them. So I would say we work hand in hand with the Ministry of Health.
Okay, that's good. That's good to hear. Another question from Felicia I.B. Nuomo says it's a myth which has to be debunked with information. So referring to the rumors that are being propagated, especially on social media and services like the most popular services like WhatsApp are obviously the main vector right now. This is an aside, but Felicia, I question whether information is going to be sufficient to break through the rumors, and get people to actually recognize them as rumors, as false information. Information is likely to be necessary but insufficient. That's a topic I hope we'll be able to discuss and explore in the Peer Hub. But thank you for that comment by all means. Charlotte, are there any questions in the chat in Zoom for Angela?
So far, no questions, Reda, and just to say, I got disconnected for a short while, but for now, no questions from this end.
Okay, great. And sorry about that. We knew, so we all will suffer from connection problems. I may get disconnected. I had a power outage in my building 2 days ago, which brought down unfortunately, it was only a rebroadcast, so it wasn't a live stream. So we have an interesting, let me see, I think this is a comment. This is sharing experience by Theophilus Kofi Tsatsu Tsikata Woyome. In my municipality, he says, we have grouped mothers and caregivers into those who receive immunization on Tuesday and those with immunization on Friday to ensure physical social distancing and adherence to COVID-19 protocol. So, Angela, in the work that you do, maintaining the supply, you do not deal directly with caregivers, or do you? Can you clarify that?
Well, in my situation, I would say I don't deal with the caregivers directly, but we have an interaction with the health facility personnel, who then would give the care to the caregivers. So sometimes we also offer training to the health facility personnel, and we emphasize on proper immunization program.
Right. Now, Charlotte, in fact, had told me about the coaching and the support that you provide to immunization staff. So, Charlotte, could you share with us and ask the questions for Angela so we can wrap up with for today's live ideas? Sounds like super fascinating work, and that you were quick to adapt to digital. Charlotte, what questions do you have for Angela on this issue?
Angela, I want to find out a little bit about contingency planning. You talked when the question from Shalini about percentage of breakdowns, you talked about, okay, it's quite normal, but has there been an adjustment in contingency planning of the cold chains, what to do in case of a breakdown within the context of COVID, that we know lockdowns and all of that? So, or it's still the same as it was before the pandemic?
Because of the support we're getting from the Kenya government, we are able to cover the breakdowns. I would not be able to give a percentage now. It's not as much as before, but the most important thing is that we are able to monitor remotely from our offices, and we're able to avoid you have to travel, and you can also do it remotely. So we're trying to support the immunization personnel. In case they have any problem, they should feel free to contact us at any time, and have assurance that in case they have a problem, we'll be there on time when it is required.
All right. Thank you very much, Angela. For me, Reda, I don't have any question for Angela again.
Yeah, there's some great comments coming in now. It's always towards the end of the session. People have had time to think about and listened, and that's really impressive from this audience. Itse Olaoye, who says increasing frequency of sessions to reduce crowds and maintain physical distancing and outreaches to catch up and reduce health facility encounters. I guess that's what she's proposing. Sally Oniondo Odiambo, who says, but is this grouping of mothers working, so the Tuesday, Friday schedule? Because in my experience in immunization, one of the barriers to service seeking is a practice of separating days for immunization, unless this is very well communicated. Thank you, Sally. This is the kind of very specific experience sharing that we're looking for, even if it's not directly related to what Angela Kisoso, whose work focuses on supply chain, we've been discussing. So starting Monday, we are kicking off the COVID-19 Peer Hub. And this is when we will be going much further than we have in these short sessions, very short sessions, intentionally so because we know you are short on time. But starting on Monday, we're kicking off the Peer Hub. If you have not yet received your letter of acceptance, you will soon, unless you have not been accepted. You can apply until the 26th of July, 2020. But basically, if you took time to complete the application and you shared your story and you told us how the work you're doing is related to maintaining immunization services during the pandemic, you can expect to receive a letter of acceptance. So that's for everyone who's been accepted. We'll be starting Monday, and then we'll be having a launch event for everyone that will bring together the entire community, 15,000 people from over 90 countries. Who should apply? Immunization staff at national and subnational levels are especially encouraged to apply. Just to clarify, this is not a course. This is a program in which we will learn to work together in new ways to help you get the job done, not the coursework, but the job that your Ministry of Health, your employer, your partners are asking you to do. That's what we'll be entirely focused on. There will be no superfluous or time-consuming tasks. Everything we're going to do is going to be focused on strengthening the response by being connected to each other, sharing our experience, learning from each other, and there will be a lot of flexibility for you to be able to determine how much time you are willing and able to put in. So I want to thank, again, I know there's a great question from Sohini and many other comments that we haven't been able to get to. So thank you so much for being with us, following along with these daily live sessions. This has been a kind of festival of sharing experience with now several months under our belts of figuring out how to adapt and change during the pandemic, but this is likely to be only the beginning. Hence, we need to strengthen the ties between us. We need to find new ways to communicate and use these digital tools to go further, faster than we ever have before. That's the spirit of it. I look forward to seeing as many of you as are ready to commit to the Scholar COVID-19 Peer Hub. Thank you so much to Charlotte, who has been preparing these sessions all week and finding amazing stories from the over 3,600 applications that we have received. Thank you, Doreen Imanyara, as well for attending. D. Marcus, who says we are grateful. And yes, that's it for today. Rendezvous Monday for the kickoff for the COVID-19 Peer Hub. Thank you, and see you soon.